Good morning, students. Today, we will embark on a fascinating journey into the world of medical nanotechnology and its application in organ transplantation. The field of nanotechnology has revolutionized various aspects of medicine, and organ transplantation is no exception. With unprecedented capabilities at the nanoscale, scientists and researchers have made remarkable progress in improving transplantation outcomes, enhancing the efficiency of drug delivery systems, and developing innovative approaches to preventing organ rejection. Nanotechnology involves working with materials and structures at the nanoscale, typically between 1 and 100 nanometers, to create devices and systems with improved precision, specificity, and efficacy. In the context of organ transplantation, nanotechnology offers immense potential to overcome existing challenges such as organ scarcity, immune rejection, and post-transplant complications. Throughout this course, we will explore the remarkable advancements in medical nanotechnology and their implications for organ transplantation. In this section, we will provide a comprehensive overview of the application of nanotechnology in organ transplantation. We will discuss the fundamental principles of nanotechnology, including the manipulation of matter at the atomic and molecular levels. Additionally, we will explore how nanotechnology has emerged as a promising approach to address critical issues in organ transplantation, including organ rejection and complications associated with immunosuppressive drug regimens. This topic delves into the use of nanomaterials for immune modulation in organ transplantation. We will discuss how nanoparticles can be designed to interact with various components of the immune system, thereby influencing immune responses and promoting tolerance to transplanted organs. Specific examples of nanomaterials, such as liposomes and polymeric nanoparticles, will be explored, highlighting their ability to modulate immune cell function and prevent organ rejection. One of the significant challenges in organ transplantation is achieving efficient and targeted drug delivery to the transplanted organ. In this topic, we will discuss how nanotechnology has enabled the development of targeted drug delivery systems specifically designed for organ transplantation. We will explore various nanocarriers, including liposomes, dendrimers, and polymeric nanoparticles, and discuss their ability to deliver immunosuppressive drugs directly to the transplanted organ, reducing systemic side effects and improving therapeutic efficacy. Assessing the viability and quality of donor organs is crucial for successful transplantation. In this section, we will explore the role of nanotechnology-based biosensors in evaluating donor organ suitability. Nanosensors equipped with specific recognition elements can detect biomarkers indicating organ damage, ischemia-reperfusion injury, and tissue rejection. We will discuss the potential benefits of these biosensors in facilitating informed decision-making regarding organ transplantation. Organ preservation is a critical aspect of transplantation, as it impacts organ viability and graft survival. Using nanotechnology-based approaches, we can significantly improve organ preservation techniques. In this topic, we will explore how nanoscale materials, including cryoprotectants, nanoparticles, and nanocoatings, can enhance organ preservation by minimizing ischemic tissue injury, preventing oxidative stress, and preserving cellular integrity. Tissue engineering and regenerative medicine hold immense promise for organ transplantation. In this section, we will discuss how nanotechnology plays a pivotal role in fabricating biomimetic scaffolds, nanofibers, and nanoparticles for tissue engineering purposes. These nanomaterials can provide a conducive microenvironment for cell growth, differentiation, and vascularization, ultimately leading to the regeneration of functional organs suitable for transplantation. Accurate imaging plays a vital role in determining organ health and assessing potential complications after transplantation. In this topic, we will explore how nanotechnology has revolutionized imaging techniques, enabling the visualization of intricacies at the molecular and cellular levels. We will discuss the application of various imaging modalities, including quantum dots, magnetic nanoparticles, and nanotube-based sensors, in organ transplantation monitoring and post-transplant evaluation. Preventing organ rejection is a paramount challenge in transplantation medicine. In this section, we will explore how nanotechnology offers innovative strategies for anti-rejection therapies. We will discuss the development of nanocarriers for targeted delivery of immunosuppressive agents, as well as the use of nanomaterials to encapsulate immunoregulatory molecules, such as siRNA and microRNA, to control the immune response and enhance graft acceptance. The concept of nanorobots performing precise tasks within the human body has captured the imagination of researchers. In this topic, we will discuss how nanorobots can be utilized to improve organ transplantation outcomes. We will explore the potential applications of nanorobotics, including targeted drug delivery, removal of toxic metabolites, and tissue repair and regeneration, while also considering the challenges and ethical implications associated with this technology. Achieving immunological tolerance to transplanted organs eliminates the need for long-term immunosuppression and reduces the risk of complications. In this section, we will discuss how nanotechnology can be used to induce immune tolerance. We will explore various nanoscale approaches, such as antigen-specific tolerance induction using nanoparticles, regulatory T-cell expansion, and the use of engineered nanomaterials to modulate immune responses. Post-transplant monitoring and follow-up are crucial for assessing patient outcomes and detecting potential complications. In this topic, we will explore how nanotechnology-based sensors and monitoring devices can provide real-time data on organ function, immune responses, and drug levels. We will discuss the advantages of these non-invasive monitoring techniques and their potential impact on patient care. As we delve deeper into the realm of nanotechnology and organ transplantation, we must address the ethical and regulatory considerations. In this section, we will explore the challenges associated with the development and implementation of nanotechnology in the field of transplantation. We will discuss issues such as safety, privacy, informed consent, and the role of regulatory bodies in ensuring responsible and ethical use of nanotechnology. In conclusion, the integration of nanotechnology in organ transplantation holds immense promise for improving patient outcomes, reducing complications, and addressing critical challenges associated with transplantation. With the ability to manipulate matter at the nanoscale, nanotechnology provides avenues for targeted drug delivery, immune modulation, tissue regeneration, and advanced imaging techniques. However, ethical and regulatory considerations must be carefully considered to ensure responsible and safe implementation of nanotechnology in the field of organ transplantation. I hope you all find this course both enlightening and inspiring as we explore the fascinating world of medical nanotechnology in the context of organ transplantation. Let's prepare ourselves for an exciting and insightful journey ahead.